Hello, my name is Mariam, and today I'm going to be telling you about differentiation of tumor cells, anaplasia, and dysplasia. Differentiation describes the process by which immature cells become mature cells with specific functions. However, in cancer, this describes how much or how little the tumor tissue resembles the normal tissue it came from. Well-differentiated cancer cells look and behave more like the normal cells in the tissue they started to grow in. Tumors that have well-differentiated cancer cells tend to be less aggressive. This means they tend to grow and spread slowly. Well-differentiated cancer cells are considered low-grade. However, there are always some exceptions. For example, papillary thyroid cancer, which is the most common type of thyroid cancer, is well-differentiated but can exhibit aggressive behavior. Another example is adenocarcinoma of the lung. Undifferentiated or poorly differentiated cancer cells look and behave very differently from normal cells in the tissue they started to grow in. These cells look immature and aren't organized in the same pattern as normal cells. These tumors tend to be more aggressive, they grow more quickly and spread more often, and have a worse prognosis than tumors with the well-differentiated cancer cells. Cancers that are undifferentiated or poorly differentiated are considered high-grade. Here you can see the relationship between the grade and the differentiation of the tumor. Grade and differentiation are basically the same, but grading is a standardized way of measuring the differentiation. You can see that as the tissue becomes less differentiated, the grade of the tumor increases. Anaplasia describes cells that are undifferentiated or poorly differentiated. This means that they lose characteristics associated with a certain tissue. Anaplastic cells have hyperchromatic nuclei, prominent nucleoli, a nucleus cytoplasm size ratio which is close to 1:1, and they show increased mitotic cell division. An example is anaplastic thyroid cancer, which usually occurs after 60 years of age and has a very poor prognosis due to its rapid local growth. Dysplasia is a disordered precancerous epithelial growth, which is not considered a true adaptive response. It is characterized by loss of uniformity of cell size and shape, also by loss of tissue orientation and organization. You can see nuclear changes like an increase in nuclear cytoplasmic ratio and clumped chromatin. Usually, it's preceded by a persistent metaplasia or a pathological hyperplasia, which I will give you examples of in the next slide. Mild and moderate dysplasias usually regress with alleviation of the inciting cause, and severe dysplasia often becomes irreversible and progresses to carcinoma in situ. Here in the photos, you can see that as the dysplasia becomes more severe, the tissue loses its architecture and the nuclei become darker due to the clumped chromatin, and they also increase in size. Here in this slide, you can see some examples of dysplasia. Cervical intraepithelial neoplasia is a precursor of cervical cancer. It usually is caused by being infected with HPV after a long time. Dysplasia can also occur after persistent Barrett's esophagus, which is a condition in which metaplastic columnar mucosa replaces the stratified squamous mucosa that normally lines the distal esophagus. Dysplasia can also occur after long-standing endometrial hyperplasia, and that is usually due to unopposed excess of estrogen. Here is a table that summarizes the differences between anaplasia and dysplasia with some examples. Thank you for your attention and good luck.